Hi, I'm Mike Dunlap, and I'm the manager of the Cardiopulmonary Rehab program at Carolina East Medical Center in New Bern, North Carolina. I'm also the president of the North Carolina Cardiopulmonary Rehab Association, and I'm proud to be able to show you our program as part of the NCCRA Program Showcase. Our program started way back in 1982, so it's actually about 35 years old. It had many locations around the main hospital campus at Carolina East in New Bern. But 2 years ago, we were relocated to the Carolina East Heart Center, which is a clinic about 3 miles from the main hospital. So our program is located on the second level of a very nice clinic. We are staffed by 2 RNs, 2 exercise physiologists, and 1 respiratory therapist. We also have a secretary receptionist. Our program is only a phase 2 program. I do see patients in the hospital prior to discharge, which you could loosely call a phase 1 program, but it doesn't involve any active therapy or ambulation. It's just consultation and setting them up for an outpatient cardiac rehab program. Once that's been done, then we do schedule for our patients to come out to our program. We have 6 classes a day that can hold up to 16 people per class. We currently see between 60 and 70 patients per day, like I said, spread over 3 days, Monday, Wednesdays, and Thursdays. Tuesdays are our nursing assessment day for new intakes for new patients, and also a makeup day for our regular patients who may miss one of the regularly scheduled appointments. We also do educational classes. In fact, we're currently in our conference education room where we start every class. This is where the patients come in 6 times a day prior to their therapy, and this is where we prep them, check blood pressures. We have a little sign-in procedure where they record their names. We give them, we do blood pressures, pulse oximetry checks, blood sugar checks. We do telemetry monitor. We have 12 telemetry monitors available for the 16 channels that we have on our telemetry system. And so this is where the day actually starts for our patients and for us is in this room. So I think we'll go ahead and proceed to our therapy area, which we can show you where we actually do the cardiac and pulmonary rehab therapy. All right, now we're in our main therapy area. We call it the gym. We actually have 8 new steps. We have 7 treadmills. We have 2 stationary bikes. We have 1 recumbent bike. We have a walking path around the outside of the room, so we can do 6-minute walks, and some patients prefer just to walk. They're not comfortable walking on a treadmill. We do have an office that we use for nursing assessments. It's a manager's office where I spend some of my time doing the different administrative things that have to be done. We have a staff area, kind of a staff lounge where staff can have their lunch, have a break time, and can get away from the main therapy area. As I said, we have 6 classes a day, up to 16 patients per class. We are certified by the AACVPR for both cardiac and pulmonary rehab. We also participate in the AACVPR data registry, where we can submit our outcomes from our program onto the data registry to compare our outcomes to other programs in the state and programs nationwide. Some of the unique things I think we do is we really do connect well with our patients. All the patients get a name tag with just their first name on it. Due to HIPAA, we just limit it to the first name. If they have a yellow name tag, it means that they are a cardiac patient. If they have a blue name tag, it would mean that they're a pulmonary patient. If the ink on their name tag is in red, it means they're a diabetic patient. So this helps us when we're managing our patients' volumes to be able to tell right away, because we do intermix our cardiac and pulmonary patients together, and so there's no confusion in that regard. Staff is really good at making the personal connection with the patients. We get to know them pretty well. They get to know us very well. It seems like once they realize we're here to help them, and it's a pretty positive relationship. We have a lot of fun with the patients. We have televisions around the room, so we usually have game shows on and that sort of thing, Jeopardy, Who Wants to Be a Millionaire, and some of them will, the patients like to engage with one another with that. Any kind of a celebration, a holiday, St. Patrick's Day, Valentine's Day, Christmas, the staff is really good about kind of decorating the facility to kind of reflect the season. Many times we'll invite the patients to participate, maybe in Halloween. We wear costumes. The patients are invited to wear costumes. St. Patrick's Day, you can imagine there's a lot of green being worn. Around Christmas time this last year, we did an ugly sweater contest, and we invited the participants to participate in that, and that was a lot of fun. And so we do really encourage and promote getting to know our patients very intimately, and they're very secure and comfortable in visiting with us, a lot of the issues they may be concerning them, and then we can hopefully give them some good advice and steer them in the right direction. We're very involved with the NCCRA in that we try to get our staff to attend the fall meetings that usually occur every fall in either the coastal area, the Piedmont, or the mountain area. Of course, we're in the coastal area, so we've hosted that meeting here when I was the vice president for 3 years, and then we were all able to, our whole staff was able to participate in the spring meeting in Chapel Hill, the NCCRA Symposium. And so that was a really great opportunity for our team to come together and spend a day and a half over at a workshop together. We really enjoyed the opportunity to network with other programs, get to know some of their staff, have a chance to visit about some common concerns and how we can better address those. So I think the biggest benefit we gain from the NCCRA is the networking that we've developed with other programs, as well as the educational opportunities that are presented through the association. Well, that concludes our video showcase of our program here at Carolina East. If you're ever in New Bern, we'd love to have you stop by for a visit. We're located at the Carolina East Heart Center. You can find our contact information if you'd ever want to call or email any questions. And we're located on the nccraonline.org website. And I really encourage you to get on the website and kind of click around and see what's being posted out there. So we try to keep it updated with the latest information from our national organization, the AACVPR, and information from Medicare and from Palmetto, our MAC provider here in this area. So again, thanks for this opportunity, and I hope to see you real soon.